Okay, so I've got Michele Worden here with me again for a second time. I'm just going to mention briefly that Michele was an advanced neonatal nurse practitioner at the Countess of Chester Hospital. I've done a full biography for Michele in the first video that I did with her, so if you want to know more, please watch that video. So, hello, Michele.
Hi Chris, how are you?
I'm very well, thank you. How are you?
I'm good.
Good
Enjoying the
stuff.
sunshine.
Yeah, well, it's not been very sunny here, I must say. It's actually torrential rain today, but never mind. Um, So today we're gonna talk. Last time we kind of spoke quite specifically about the Countess of Chester Hospital and some of the background to that. So today we're going to talk more about the infants from Lucy's case and some more kind of general nursing topics.
Yeah.
But first of all, I'm going to ask you that I know that you know quite a few people from Lucy's social circle, although you don't know Lucy herself. So I just wondered if you could give me your impression of what she was like before all of this happened from what you've been told.
Well, I know of Lucy from her other nursing colleagues who worked at the Countess of Chester, who met her when she started employment there back in 2012. And she formed some very strong friendships with many of them. And they enjoyed a good social life after hours. They'd go out. She took up salsa dancing with a couple of the nurses, as there's a salsa dancing club in Chester. She was quirky, but she was very focused. She loved her career. She wanted to rise through the ranks of nursing and to become an advanced neonatal nurse practitioner. She took every opportunity to enhance her education. She was always willing to change shifts because, unlike some of her friends, she's not married. She didn't have family commitments, children. Her parents lived 200 miles away. So her entire friendship group, with the exception of a couple of friends that she went to school with who were still in Hereford, was based in Chester. And from my understanding, she was a completely healthy, normal, fun loving, but dedicated nurse who worked hard and played hard.
Yeah, and I think, I mean, I was discussing this the other day in another video when she was removed from the unit, because she was, as you say, she's essentially 200 miles away from where she comes from, and her life was the hospital. She was very much isolated because of that. Um,
Totally isolated. And she was lied to. So she went on holiday to Ibiza. And when she came back, fully expecting to return to work, she was informed that she was going to be put on clerical duties in an office. Um, all of the nurses on the unit were told that this was going to be a new type of training program by the Countess of Chester. And it just happened that Lucy was the first one to be moved, but they were all going to be rotated over a period of time to increase their skills. At the time when I was told that, I thought, that's a bit odd. Why would you take clinical nurses off clinical duty and put them into a clerical position in an office? It didn't make sense, but nobody was raising any alarms. Nobody at this point, certainly within the nursing group, knew what the implication of this was. They knew that they'd had a number of babies tragically pass away and a number of babies collapse. Um, but they didn't join the dots up. And management, all the consultants, didn't tell anybody. So it was a bit odd, um, but they all took it at face value and thought they would all be rotating. And as time went on, when you look at Thirlwall and some of the statements that have been issued in that, you can see how the medical staff were all chit chatting about it behind closed doors and emailing each other, but the nurses were completely in the dark. And even when it was escalated to senior managers, such as Karen Rees, um, Lucy was still completely in the dark about any potential accusations. Because it went on for so long, that's why she took the grievance up, because they wouldn't tell her what was happening, and they wouldn't tell her when she was returning to clinical duties. In fairness, all of their behaviour was disgusting. I think if you're going to point the finger at somebody, then they should have been completely honest with her and said, you're suspended, you're on gardening leave while we conduct inquiries, and been as honest with her as they could. But they weren't. They were very deceitful. Karen Rees, in one of her Thirlwall statements, actually says that she was really upset because she knew what the consultants were accusing this nurse of, but the nurse herself had no idea. And Karen found that very distressing. And I can completely relate to that. It must have been an awful position that the senior nurses were being put in.
Yeah, so I mean, clearly, morally and ethically, that shouldn't have happened. But do you think, legally, it's
Well,
wrong?
I think if there was a consultant who was accused of harming patients, I don't think they would move him to clerical duties. I think they would have put him on gardening leave while they investigated. And they certainly did that with Susan Gilby, who was the chief executive after Tony Chambers. They didn't put her on management duties. Or returned her to clinical practice because she is a doctor. They put her on full pay on gardening leave. And I think that's what they should have done with Lucy. They should have been honest and said, this is what you're being accused of. We are investigating. But meanwhile, you're going to be put on gardening leave on full pay.
Yeah.
Because that's certainly what they do with doctors. But it's, as a nurse, you're a second-class citizen very often. It's just like when I was made redundant, I went to Dr. John Gibbs and said, you do know, John, what's happening to me and what's happening to the other senior nurses on the unit. And he wasn't interested. He just said, it's a nursing issue and I've been told to butt out. And at that point, I actually told him, this is an accident waiting to happen. You can't run an intensive care unit with no senior nursing staff. But there's one rule for the doctors and certainly the senior managers like Susan Gilby, and another for nurses. And I think in the future, all of this needs to be looked at very carefully about how staff across the board are treated under these circumstances, because it's not an equitable playing field.
Yeah, I mean, so I've heard so many stories from people who work in the NHS who tell me all the same thing about this cultural issues, how hierarchical it is and so forth. And that seems to be really ingrained in the NHS. Whether it's ingrained in private hospitals as well, I don't know. I would imagine it probably could be. But I mean, do you think there's any hope that that could change? And if so, how would it change?
I think it is starting to change because doctors in the past have always been treated as if they're gods. And I think some of that comes about also from their medical training, that the universities enhance that ethos. The younger ones now coming up through the ranks, I think, are far more open to discussing things and having a good working relationship with all staff, not just nurses. But in the past, I mean, if you take Dewi Evans is definitely of the old school, and he thinks he knows everything. In the recent TV documentary, he actually says, when he's questioned about the expert witnesses now for the defence, that maybe they don't know as much as he does. But he's a consultant paediatrician. He's not a professor. He's not a neonatologist. He's not worked clinically for nearly 20 years. But he is so arrogant, he thinks that he knows more than anybody else. And he was a hired gun. He was paid a lot of money, and he's on record as saying that he's never lost a case. But as an expert witness, it's not up to him to win or lose. It's up to him to give a professional opinion. And he gave a professional opinion based on she's guilty, I'm working for the prosecution, I'm earning a lot of money. And again, he's on record as saying, well, I have to fund my daughter's horse and my son's car. He wasn't interested in getting to the truth or justice. He was interested in lining his own pockets.
I mean, I've highlighted in the panorama that he firstly said, I mean, bear in mind as well, he's getting the softest interview that he possibly could from anyone.
Yeah.
And then he's saying, oh, in my medical opinion, it was inflicted harm. And then she's asked him, will people say there's two different methods? And he just says, well, it doesn't matter. I mean, it's just unbelievable.
Yeah.
I mean, he's just confirmed exactly what he did, that he started off with a presumption, then he worked backward from that presumption.
Yeah.
He's just gone on BBC, one prime time, and just told everyone.
And he changed his mind during the trial. I mean, on the stand, he said, oh, this baby she's injected with air. Well, maybe she overfed it with milk, but it doesn't matter because then she injected it with air to cause an error. I mean, it's like, in fairness, Jonathan Coffey on that programme said, well, it's like saying this patient's shot. Oh, wait a minute. No, they're not shot. They drowned. But that doesn't matter because they died anyway. It's nonsense.
It is absolute nonsense. So speaking of the trial, we've already painted this picture of Lucy being quite a healthy, social person when she was a nurse. So I wanted you to tell this story about what happened before every day in court with Lucy, because I don't think I've heard it. So.
Yeah, I think you have to sort of go back. So Lucy was removed from the unit, which was very traumatic. She wasn't allowed to work clinically, which she really wanted to do. She was put on a desk job. She's not a secretary. She hated being in an office. And then as time went on, it was the slow realization of what she was being accused with. So she became very anxious. It's documented again in court and in Thirlwall that she started having panic attacks. The hospital recommended that she went for counselling, and the hospital counsellor undertook that, Catherine de Bourgh. She went to the GP and was put on antidepressants. All the way along, she was lied to because she was told every nurse is going to rotate out. This is a new hospital thing. Then it turned out she was being accused of the most heinous crimes. Then her friends were told not to contact her, so she was isolated in her own home. She was undergoing counselling. She was told, oh, don't worry, they're involving the police, but the police won't charge you. And then, of course, the police did charge her. And then she was put into jail. At this point, she's 27. She's put into top security jails because of the crime she's accused of. The press get hold of her name and start writing the most horrendous headlines long before she's ever been to trial. Angel of death, nurse of death, serial child baby killer, if convicted will be the worst child serial killer in the history of the UK. I mean, all of this was prior to the trial. I cannot imagine how frightened she must have been to be put into a prison that is a top security prison. Secondly, everybody knows that when you're in prison, prisoners have their own pecking order. And she's been accused of murdering babies. So she's at very high risk of being attacked. I mean, it's just unimaginable. My daughter is a similar, my son is 27, the same age as Lucy. I can't imagine how he would react under the same circumstances, let alone a young female. Boys may be a bit more tougher, but she got PTSD. It's also reported that at one point they moved her from one prison to another and they forgot to take her medication with her. And I think it was Ben Myers who said she was in a terrible state because she was so anxious, so fraught with fear, which she would be. And then you've got this trial coming up. Um, she's so traumatized by this time that the judge allowed her to enter the courtroom prior to anybody else. So when the jury came in, and the barristers and the public and whoever, Lucy was already in the dock so that she didn't have to face the trauma of walking through everybody. She's heavily medicated. Judith Moritz, in her awful book, says, oh, well, she was beige and she didn't express emotion. Well, this girl's on sleeping tablets. She can't sleep. She's on antidepressants. She's traumatized. She's got PTSD. Her life is destroyed. She's facing the most horrendous accusations. And Judith Moritz says, oh, she doesn't behave normally. Well, who would? Who would behave normally in that situation? I don't think I would. And she's 30 years younger than me. So my heart goes out to her. And I think it's terrible that a lot of things were in the press before she even got to trial. That is not a fair trial when they probably would never admit it. But I bet some of those members of that jury had read those headlines.
Of course they will have done. I mean,
yeah,
it's inevitable, isn't it?
Absolutely. It's the justice system in the United Kingdom is not what I ever thought it was. And the justice system, along with lots of other things, need a radical overhaul. It needs to look at who it classes as an expert witness, how the two barristers, Nick Johnson wasn't interested in getting to the truth. He was interested in getting a conviction. And he did a very good job. He got 15 whole life tariffs. He's top of his game. Ben Myers, I don't know why Ben Myers did the appalling job that he did. Maybe I don't know, maybe he just thought, oh, this is she's never going to win. Or maybe he thought the jury aren't going to believe any of Dewi's evidence. I mean, who knows? But it was a very one-sided, biased, prejudicial trial.
Yeah, I agree completely. I'm just going to add to what you said that the comments of Judith Morris are idiotic. It should be clear that they're idiotic anyway, but I mean, she's still sticking to it because she gave an interview, I believe yesterday it was, on Times Radio, and she's still saying, oh, I was in court, we saw Lucy in court. Is irrelevant. Irrelevant. The way, I mean, it has nothing to do with the case. Your opinion on how you perceived her demeanor in court. I can't believe you're sticking to that, but it's just absolutely embarrassing. So, I mean, I was even going to try and respond to that radio interview, but it's so crap. I just don't think it's worth it. But I mean, I think the things that she has said are extraordinary for someone that's supposed to be a critical person. It's what you're supposed to be as a journalist, and to sit there saying, "Oh, she wasn't sad enough." Well, I mean, she was distraught. She was devastated by this point. How anyone cannot see that, I just can't understand it.
No, I don't understand it. And it's a bit like the so-called confession notes. From the first time I read those, to me, they were absolute cries for help. They were someone in terminal anguish. And again, Nick Johnson sold a story for what he wanted to say. So he cherry picked. Oh, she says she's evil. She wrote that down. She says she's not good enough. But he didn't cherry pick, I'm innocent. Why are they doing this to me? He didn't mention any of that. And Ben Myers tried to bring those up, but he did it in such a quiet, passive way. I think it completely bypassed the jury.
Yeah, it should have been done more strongly for sure.
Yeah.
So speaking of Cheshire Police, you approached them at some point. Could you tell me what happened when you did and roughly when that happened?
Okay, so it was 2018 after Lucy's first arrest. So I'd heard all these rumblings for a long time from my friends, and I'd been informed that the Royal College of Paediatric and Child Health had been called in. And one of my friends gave me a copy of that report in 2017. And I read it and I cracked out laughing because it just said everything that I've been talking about ever since my redundancy, that registered nurses shouldn't be replaced with unregistered nurses, with, don't get me wrong, nursery nurses have a role to play, but they shouldn't be looking after the sickest babies or high dependency babies. And they certainly shouldn't be replacing registered nurses. So I read the report. The report also made recommendations that they should employ two ANMPs. They needed better communication between the nursing and medical staff, that the staffing wasn't adequate. I mean, the list just went on. It's available if anybody wants to read it. So I phoned Cheshire Police and spoke to a policewoman and told her about the Royal College report. I don't think she'd read it. She certainly wasn't very interested in it. She implied that the staffing wasn't relevant. And did I know Lucy? Did I work with Lucy? And did I have any evidence against Lucy? And the answer to those three questions are no. And that was the end of my conversation with Cheshire Police. So then I tried to find out who Lucy's solicitor was. And eventually I found out it was a gentleman called Richard Thomas at Russell and Russell Solicitors in Chester. So I phoned them twice, left messages, never got back to me. And then when Lucy was charged in 2020, I found out that Ben Myers was her defence barrister. So I emailed Ben Myers with a long email about the staffing, employing too many nursery nurses, the Royal College report. I talked about all sorts of things. I talked about the whoosh test and why this injecting air is so ridiculous. I know he received that email because his clerk emailed me and said, "Thank you very much. I forwarded it to Ben Myers." And I never heard anything.
Yeah, it's I with regard to the police, I just analysed the first police interview Lucy in the most recent video. And I think it's very clear from that interview that they'd already made their mind up. And all they were doing was trying to build a case against her. But from what you said as well, it sounds like they'd already made their mind up prior to that. And if you look at their video as well, that they made Operation Hummingbird, it seems that they made their mind up even earlier than that, because I think I don't really understand it, but they just became fixated. It's so strange that it's on the 12th of May 2017, they're not going to investigate. Then Ravi and Stephen Breary go in and meet them. Then they just decide to investigate. Then Dr. Evans walks in, probably in the same month, we don't know exactly when, and says, "Oh yeah, this is definitely inflicted harm." And then after that, they just never can consider anything else, it seems.
Well, the police, I think, were starry-eyed with Ravi and Steve Breary. And it goes back to what we were talking about before, that doctors are treated as gods. Trust me, I'm a doctor. Patients rarely question doctors, though that is changing now with all the information out on Google and so on. But even 10 years ago, 15 years ago, doctors are very much treated as they are superior, they know what's what. So I think, in fairness to Cheshire Police, they were faced with two consultant paediatricians who came and told them this story, that they didn't understand why these babies had died, and that they'd called various experts in who, although they said that it was natural causes, they still didn't believe that it was natural causes, and they wanted the police to investigate. And I think Ravi probably sealed the deal, because he said about baby Kay that he'd walked in and she'd been doing nothing, and the tube was dislodged. And certainly on the ITN documentary, he says, well, the only reason an endometrial tube in a 25-week gestation baby can be dislodged is because somebody's done it. And that is an absolute blatant lie. But he said it to the police, I'm quite sure. And they went, oh, okay, we need to investigate. They didn't do due diligence and investigate these two doctors. And then they had a third consultant pediatrician turn up, who was Dr. Dewi Evans, who went, yeah, this sounds like my kind of case. Oh, over a cup of coffee. Yes, this is an afflicted liver injury. And then they were off. They were, they had the three consultant pediatricians, and they had a further five in the background from the Countess, who were a lot more hesitant than Ravi and Steve Breary, but started to say similar things. And the police just ran with it. But the police were absolutely out of their depths, and alarm bells should have rung all over the place, red flags. When Dewi turned up and within 10 minutes, I mean, that's a massive red flag. The experts that now Mark MacDonald has got, I know because I'm in contact with some of them, have spent weeks and months poring over thousands of pages of observation charts, fluid balance charts, prescription charts, medical notes, nursing notes. But Dewi knew within 10 minutes.
Mm.
It's worthy of Harry Potter. It's fantastical.
Yeah. So, I mean, I totally agree with you that the police are out of the depths. I mean, that's not open to debate. But, I mean, surely, like, when I started doing this, when I first became interested in Lucy's case, I don't think I really knew what a neonate was. I mean, I might have been able to guess from the words and the meaning of the words, but, I mean, I knew nothing. But I just educated myself from reading about things. I mean, couldn't they? That if someone he's obviously made the claim about the tube coming out, and it's really strange. I mean, that's the kind of thing that they should corroborate. I mean, I actually got a comment from someone that I'm going to read out at some point in a video in the future, pointing out all the mistake, all the things the police should have done. So, for example, at this point, these two pediatricians had taken out a grievance procedure. I mean, essentially, they're instrumental in the grievance procedure against Lucy. So the police should know about that. They should find out about that, and they should think immediately, hold on a second, these two people have just taken a grievance procedure out against this nurse, who not only that, but they lost on every point was upheld. We've just allowed them to walk in and they make it so obvious that it's Lucy. There's no way you could go through that interview and think, oh, I wonder which nurse it is that they suspect. They basically might as well have just walked in there and said her name, really. So
Steve Breary wrote the roster chart that was instrumental showing Lucy was on duty. He chose the babies along with Dewi Evans. So he looked at 25 babies. Oh, I think there was 28 initially. Then they cut it down to 25. And then it's when Ariane first, because he asked Ariane Powell, who was the manager of the unit, to help him look at who was on duty. Ariane included all the medical staff, and he took them off. Well, you're already altering potential information if you're removing some of the staff who also looked after those babies. And certainly we know when Jane Hutton was potentially going to be engaged, she said, I want to know all the babies, not just the ones who've died or collapsed. I want to know all the babies. I want to know their gestation. I want to know every member of staff, including the cleaners who walk into that unit. I want all this information, times, dates, everything. And then the police turned around and went, oh, actually, she's asking too many questions, so we're not going to employ her. I mean, the police are as culpable in my book as the doctors, because they did not do due diligence on any level at all.
I agree. I mean, I agree completely. I think they shouldn't be let off lightly because I accept it was a very difficult task for them. They don't have the clinical medical knowledge or experience, and Chester's not exactly, as we've discussed previously, it's not exactly a hive of crime or anything. So they probably don't get a lot of big cases. Now, I do sympathise with them in that respect, but at the end of the day, there's certain procedures and processes they should have gone through that they didn't. So they are culpable for what's happened to a great extent. I'm sure they'll wriggle their way out of it. The police usually do, but they should have done a lot more due diligence for sure.
I hope they learn lessons. And, I live in Chester, and as part of my council rates, part of it goes to Cheshire Police to policing. And I strongly object that
Mm.
after the trial, they went out and spent nearly £7,000 buying themselves presents and patting themselves on the back. They bought necklaces with hummingbirds on, going, "Aren't we clever?" I mean, that's just it's like a group of nurses saying, "We've saved this baby, so we're not going to buy another ventilator. We'll all have a couple of nights in a five-star hotel." I mean, it's
Mm.
disgusting. That should never happen. And I think the Chief Constable of Cheshire needs to be held accountable. What was his police force doing? He's very quiet in all of this. He's never spoken out, but the buck stops with him. And I think people should start writing to the Chief Constable of Cheshire saying, what was your police force doing? Why didn't they follow guidelines and protocols and investigate everybody, not just one person? I mean, if they always say that, if somebody gets murdered and a wife or a husband goes to the police, the first thing the police do is investigate the person reporting the crime. But they didn't do that in this case. Why not?
I don't know. I mean, it's basically the reason is because of what you said. It's because they put the consultants on a pedestal and they just allowed them to walk in there and
Yeah.
weren't critical about what they said is basically the reason. But obviously that's deeply unprofessional is the most generous thing you could say, I think.
Deeply unprofessional. And then to go out and spend taxpayers' money is, I mean, it's just unbelievable.
Yeah, I agree. So when you worked at the Countess of Chester, you told me the staffing was very different with senior house officers and advanced nurse practitioners and
Yeah.
staff split into two groups. Can you discuss this and explain the importance and potential impact of this?
Okay, so if we first of all take the medical staff. So at the top, you have like a pyramid. So you have the consultant pediatricians. We never had a consultant neonatologist, just to point that out. Underneath them, you would have registrars who are trained in pediatrics, but are at different points through their training. And once they qualify, they will then go on to become consultants. Now, those registrars could be anything from the first week they started work to 4 years down the road in their pediatric training. So there's a huge variation. Certainly, if you take baby K, we know the registrar on that night, the reason he called Dr. Jayram to come in for the delivery was he'd only been a registrar for 3 weeks and he had never dealt with a 25-week gestation baby. So you've got the registrars, and then you used to have effectively two arms. One arm they used to be called senior house officers. So they're doctors who are then training to be GPs. And this arm would be doctors who want to become pediatricians. However, in approximately 2013, the Dean of the Medical Faculty, who controls all the doctors' training within a given region, said for some reason, I'm not sending senior house officer pediatric trainees to Chester anymore. So that meant you only had GP trainees. Now, GP trainees deal with children, but they're never going to deal with neonatal intensive care. They do 3 months and that's it. They move on to another speciality. So I think in one of the baby's trials, one of the GP trainees said, I was out my depth. I'm a GP trainee. And not only was that medical rota then diluted, so you haven't got the paediatric trainees, you also, they're covered a very thin area. So in the week, Monday to Friday, you've got lots of consultants about, lots of registrars, lots of junior GP trainees. Come 5 o'clock at night, or a bank holiday, or a weekend, you're down to one consultant on call from home, one paediatric registrar who is covering labour ward, the neonatal unit, the paediatric ward, the postnatal ward, and accident and emergency. And then you've got two GP trainees, one who would be covering the paediatric ward and A&E, and the other GP trainee who would be covering the neonatal unit, labour ward, and the postnatal ward. So they're very thinly spread out. And, you know, it's dangerous. It's not adequate staffing. If you get a sick child, and I think in the trial, one of the registrars actually said that he was stuck in A&E with a very sick child. So although they were phoning him to go to the neonatal unit, he couldn't physically go because he was the only one on duty. And then you've got to phone the consultant to get out of bed to come in. Now, 90% of the time, consultants, when you phone them, they will come in, absolutely. But there is another ethos between paediatric registrars having a reluctance to call consultants, especially in the middle of the night, because they sort of feel, oh, do they think I can't cope? Do they think I don't know what I'm doing? So that's in the mix as well. And certainly that was also reported in the trial. I can't remember which registrar it was, but one of them said, you know, he was very reluctant to call the consultant because he didn't know whether it was going to be, oh, the doorbell's going, Chris. I'll have to stop for a minute. Can you go outside?
We'll have a break for a sec. So, I predicted there'd be a dog interruption. We both got dogs. I thought the door would go in my house at some point, but it never has yet. But I suppose it's inevitable there'll be an interruption at some point. Looks like a parcel. As you can see, I'm not a professional TV presenter or radio presenter who knows how to fill dead air. But the only reason I know that I won't edit this out because if you try and join together two Zoom files, it was already disastrous when I tried to do that before. And
oh God, sorry.
There we go. I've been trying to be a TV presenter and fill the dead air. I have no skill in that area whatsoever. So that's absolutely fine. So please continue with whatever you were saying before.
Where were we? We were talking about the doctors. So,
yeah.
And we know from the Royal College of Paediatric and Child Health report that there wasn't enough doctors. There was very little communication. They were using too many locums because they were short-staffed on the medical rota. So you've got all the issues with the medical staff. And then on the nursing side, when I was there, we used to have 5 registered nurses on a shift and 2 nursery nurses. But now, because they had more and more nursery nurses, they were down to 3 registered nurses on a shift and 3 or 4 nursery nurses. So if you take the night of baby K, Lucy was in nursery 2, high dependency. Joanne Williams had 1 baby in high dependency. Caroline Oakley had 2 intensive care babies. And then baby K was born. So Joanne Williams went to look after baby K, and that left Lucy in nursery 2 on her own with 3 babies. Joanne Williams is dealing with the 25-week gestation baby, and Caroline Oakley's got 2. So really, when a 25-week gestation baby comes in, or any sick baby, regardless of their gestation, to be fair, sometimes you need more than one pair of hands, but they were really thinly stretched. And if you look at some of the nurses' testimonies, so if you take a nursery nurse called Nikki Dennison and look at her statement on Thirlwall, she says that she would often babysit in high dependency and feed babies in high dependency. That should never happen. She's a nursery nurse. She's a very competent nursery nurse, but that's breaking all of the British Association of Perinatal Medicine guidelines. So the nurses was spread very thinly, and so was the medical staff. And they were getting more and more sick babies, and it just became the perfect storm.
Yeah. Um, so one of the things that a lot of nurses have told me, including yourself, and as I've been going along and speaking to people, I start off with a kind of intellectual understanding, and then over time you start to picture more and more what in your head, what's happening, what the problems are. So something that I've heard a lot is that monitoring with neonates is very important and that it wasn't done well on this unit. So can you expand on that and explain the importance of that?
Well, I don't know if it wasn't done well, but certainly they were very short staffed. And babies, when they're sick, give very subtle signs. They can't go, I've got a headache or I've got a poorly tummy. So you have to be able to look at your patient, your baby that you're caring for, and pick up on the signs that they're deteriorating or something is going wrong. And the way certainly premature infants do that is they start having desaturations and bradycardias. They might change color, they get funny skin rashes, they might be wriggling because they're distressed or even trying to cry, even though they've got an endotracheal tube down. You can see them opening their mouths trying to cry. They're distressed. And you've got to be able to pick up on those things. I think looking at lots of these babies, there was definite signs that some of them were running into trouble that were not dealt with or picked up with. So you only have to look at Baby O. Baby O, at 1:30 in the morning, started to have a distended tummy, and it's documented that you could see visible loops of bowel. Again, at 6:30 in the morning, that was documented. I mean, Dewi Evans said that that's the point when Lucy must have whacked this baby in the liver, but Lucy actually wasn't on duty. So then he changed it to, oh, well, she must have whacked this baby in the liver when she came on at 8 o'clock. But these are very subtle signs that something is going on with this baby. And of course, at 1:30, that baby had a profound desaturation and bradycardia. But then things went really wrong at that point because the baby only had a peripheral cannula in. So the registrar came, intubated the baby, took the baby back to the intensive care unit, but it just left. I mean, it's just unbelievable. He didn't stop and think, I'm going to put in a central line or a long line or an intra-arterial line. He just left. So then when the baby fully collapsed at about 3:30, 4:15, they had no lines. They only had one peripheral cannula. So the whole resuscitation just became an absolute nightmare. But they missed out on the signs earlier on in the day, and you could look at every single baby and see things like that happening that they didn't recognize the importance of.
Yeah. So in that sense, when the court case was taking place, we not only heard Dr. Evans in particular saying that, oh, none of these collapses were expected, they're all completely unexpected, but also we heard people who actually worked on the unit saying, oh, we'd never seen anything like this before, the collapse was not anticipated at all. So essentially what you're saying is that there were signs and many of them were not unexpected collapses. Would you agree with that? And could you
I
expand
think
on
I think again, it's how you sell a story. So these babies, by definition, are in a neonatal unit. And if you're in a neonatal unit and these babies are incredibly vulnerable, they can be, I've seen babies be out in nursery 4, which is special care, virtually about to go out the door, and then they pick up an infection and the next minute they're back in intensive care. Those babies go intensive care, high dependency, special care, back to high dependency. They're moving around. To say that they, I mean, it's how you say
How can I
the
just
story.
ask? Can I
What's
just ask? Sorry.
what's an unexplained collapse? Any patient can suddenly collapse. You could suddenly collapse and have a massive heart attack. It's not expected. You look perfectly well and healthy. But that's what human beings do, and especially babies do. So I think they missed lots of very subtle signs. But at the same time, people do collapse and die. And that's why, tragically, we have cot deaths. You know, parents put babies to bed fit and well, they've had their tea, they've had a lovely day. And in the morning, they go in and the babies have passed away. So it's how you sell and how you interpret a story. But these babies, I think, were portrayed as being far more healthy than they actually were, and far less vulnerable than they actually were.
Yeah, so can I just ask, how much typically do infants move around, within the nurseries?
Oh,
How,
all the time, all the time. I mean, it depends on the gestation, it depends what's matter with the baby. But I've known babies be in intensive care for 2, 3 months, go to high dependency, go back to intensive care, possibly go to another level 3 unit. They move around all the time. Until they get, hopefully, to a point where they've grown sufficiently, their immune system's kicking in, and they're well enough to go home. But even babies who are discharged come back into paediatric wards. It's a roller coaster of a ride for some of these babies. Some babies have a very smooth ride, but there's others that have a very long and tortuous journey. And it continues for a long time, because just because they go home doesn't mean they don't come back to hospital sometimes.
well, I think I'm right in saying, is it child G that was there for months? Uh,
Yeah,
I think
I've,
it's
I've,
child G.
I've known babies be in the unit for 9 months a year.
Hmm.
I think, yes, was it child G that got to the 100-day birthday? And that baby had been backwards and forwards to Arrow Park, back to Chester, back to Arrow Park, back to Chester again. It'd been a very poorly baby.
I mean, it must be traumatic for the parents. It must be so hard.
It's very traumatic. It's not just for the parents; it's for the siblings, it's for the grandparents.
Hmm.
It becomes, and that's why you build up such a rapport with these parents, because they're not just there for a week. Well, some are, but they're there, some of them are there for months. So you get to know them. You get to know the grandparents. You get to know where they're going on holiday. The siblings, if you're on it, and it becomes a way of life for those parents, which is why prior to a baby being discharged, you want those parents to come and stay for a number of nights, so that we have an area, the parents' room, so that they can have the baby on their own, but where there is a backup in case something happens, or they have a question, or they lose confidence before they ever go home. And even then, we still get phone calls in the middle of the night from parents saying, I came home a week ago and he's making a funny noise, or this or that. So it can be a really difficult road.
Absolutely. So this might be a difficult question to answer, given that you weren't working on the unit. But we know a little bit of background from various colleagues that worked with Lucy. So from what we do know, what would be your overall opinion regarding Lucy's nursing practice?
Oh, having spoken to the experts who have written the new reports, they said that Lucy's documentation was excellent. She was obviously a very good, very conscientious nurse. She recorded everything. She also recorded a lot of what's called Datixes. So if something went wrong, and it could be something as simple as, say, they were short-staffed, so an antibiotic didn't get given for, it got delayed for an hour or 2 hours, Lucy would Datix it. She would Datix everything. At times, apparently, even if she felt she'd done something wrong, she would Datix it because she wanted the system to improve, and she wanted the babies in her care to have the best possible care going. I think she was an exemplary nurse. And Nadine Dorries wrote a very good article in the Daily Mail a few weeks ago. And Nadine and I actually trained in the same hospital. And there was a matron there who, it was a vocation, it was her career. She never married. And she would turn. I remember one night when I was there, she was the head nurse of this hospital, of the Royal in Liverpool, and there was a flood, and I had to call her to coronary care, and she herself turned up with a mop and bucket. There's not many senior managers who would do that, but I think Lucy was going to be that sort of a nurse.
Yeah. So I also had a neonatal nurse look at all the Datix information that we could get from Thirlwell, and she said Lucy was exemplary in a practice and with regard to Datix. But I specifically wanted to ask you about the Datix system because I've been told by several people, both nurses and doctors, that consultants are often resistant to being picked up on their errors on the Datix system. So would you agree with that? And could you give me your perspective on that from your experience?
I would definitely say that's true. But also, they're marking their own homework. So when a Datix form is filled in, they're all collected and collated and looked at and put into which are pharmaceutical issues, which are monitoring issues, whatever. And then they used to be approximately once a month a meeting of the head of whoever reports the Datix to. And then in this case, it was Steve Breary, probably Ariane Powell, and maybe a couple of other nurses, or sometimes junior doctors would sit in on them. Just depends how it goes. But Steve Breary would go through the Datixes. So he's marking reports that potentially he could be named in. And I really don't think that would have sat very well with him at all. I think Steve Breary is very much the consultant. He's very much, well, that's all very interesting, but I'm the doctor, I'm the consultant, and we're going to do it this way. And I don't know. I've only met Steve Breary once. I actually didn't work with Steve Breary. I worked with John Gibbs and Ravi and lots of the other doctors. But from what I have read in Thirlwell, I'm shocked. I know that at one of the meetings, Ariane Powell, who I know very well, who's another excellent nurse, I worked with Ariane for many, many years. And she was at this time the manager of the unit. When they were pointing the finger at Lucy, Ariane turned to Steve Breary and said, how are you going to feel if this nurse, something happens to her or happens to her parents who are elderly? And he turned around and he said, I don't care. Now, on any sort of a human basis, I find that despicable. He wasn't brave enough to go, I'm going to go to the police myself. I'm going to escalate this to the managers. But he didn't go to the police himself, even though he thought she was potentially a serial killer. But he's very happy that her or her parents are going to die. I think he has some serious questions and soul searching to do.
I agree.
Real soul searching to do. Yeah. That's, he if I thought there was a serial killer, I would go straight to the police. But he didn't. And he's on record, I think it was him, saying, oh, we were worried about our jobs.
Yeah, I'm sure that's the reason.
He's worried about his job. And yet he's saying, I don't care if Lucy dies or her parents die. No, it's outrageous.
I'm certain that's the reason they didn't go to the police. So they didn't want to be whistleblowers. I just think it's basically cowardice.
It was cowardice. But there were so many avenues they could have gone down. So they could have phoned the coroner. They didn't say to the coroner at all, we're very suspicious here. And the coroner in Thirlwall actually said, I was shocked when I discovered all of this because they never told me. They could have gone to child protection, which has police officers sitting on it, and said, we've got concerns that somebody's harming children on this unit. Safeguarding is massive in this country. There's regional, national, local guidelines. They could have easily reported that. They didn't do any of that. They just kept kicking it down the road to the managers, and they themselves didn't go to the police. They're absolutely appalling behaviour.
I agree. So I've got to ask you about my favourite subject now, which is the handover sheets. So if I had 10 quid for any time someone came on and said, oh, what about the handover sheets? What about the handover sheets? It's easily the most cited or thing that I'm asked about the most. So obviously Lucy had some handover sheets in her house, in bin bags, under a bed and such like. I just would like to hear your view on this and if you can explain more about what they are and so forth.
So the press have misquoted what these are. These are not medical notes. They are not nursing notes. They are not observation charts or anything. A handover note is nothing more than a scrap of paper that a nurse uses as an aide memoir during a particular shift. So, yes, it does have some confidential information on it. It might have patients' names, and it might say by that patient's name needs antibiotics, needs a doctor's review, needs whatever. But it is literally a piece of paper which is a memory, an aide memoir for that nurse on that particular shift. Now, you're supposed to throw them away, but they're in your uniform pocket. When you've worked a 12-hour shift and you're tired and you haven't had a drink and you haven't had anything to eat, the last thing you want to do is start emptying your pockets. So I've come home with handover sheets. I've still got documentation that I've kept from over 20 years ago. 2007, I left that unit, but I've still got letters and emails that I've kept. Does that make me a serial killer? I don't think so. I think lots of people bring things home all the time from all variations of work. And if the definition of a serial killer, a nursing serial killer, is going to be they've come home with a handover note, well, the prisons are going to be even more full to capacity than they are now. It's another piece of nonsense. And yes, Lucy should have got rid of them. For whatever reason, she didn't. She stuffed them in a shopping bag under her bed. So what?
So speaking of nonsense, I want to talk about this accusation that Lucy reached into the confidential waste bin somehow and fished out a specific paper towel. And all I really want to ask you is that even remotely feasible?
I suppose it is feasible. I can't think why she would do that unless when you're in the middle of a resuscitation, it used to be that we would say to a nurse, and there would be lots in a resuscitation, stand there and write down any drugs that we give. So there's always somebody who's the lead for a resuscitation. So if I was the lead for a resuscitation, even though there's doctors there, I would get somebody to transcribe any of the drugs. So you'd say, okay, 1 ml adrenaline given at so-and-so, 0.5 ml of sodium bicarbonate given, whatever it is, and they write it down. And then after the resuscitation, you go to the notes and you write it in. Now it's all on the computer, but you can't physically go, oh, I'm going to go and give sodium bicarbonate and then immediately go to the computer when you're in the middle of a life and death situation. So the only reason I can think that Lucy maybe took out a scrap of paper is because somebody had written possibly drugs on during a resuscitation, and she wanted to check that they had been transcribed into the notes with the correct date and time, which actually shows potentially how conscientious she was. It doesn't show that she's guilty. It shows that she's actually been really conscientious so that everything is correctly recorded on the computer in the medical and nursing notes.
Yeah. Okay, that's great. So speaking of notes, Lucy's a copious writer of notes. Now, every nurse that I've spoken to has said that's perfectly normal for nursing. That's what you're supposed to do. That's nothing out of the ordinary. So can you talk a little bit about the culture of nurses taking notes and how this is encouraged?
Well, because you have to write down everything, even if you think it's not necessarily relevant, because as a patient potentially deteriorates, if you say, like, if we go back to baby O, that baby at 1:30 in the morning was noted to have a slightly distended abdomen with visible loops of bowel. So that nurse recorded it in the notes, and rightly so, because when Lucy came on in the morning, she called a doctor to examine that baby. Now, if you haven't documented it in the notes, that could have been completely missed. So it's important that you write everything down, even, times and drugs, and if a parent's phoned. There's a lot of discussion over baby and these phone calls and different timings. Some people say that the mother got it wrong when she got her mobile phone notes because it was on British summertime, whereas it should have been on Greenwich Mean Time or whatever. And then they twisted it and said, oh, Lucy altered the notes to fit her own synopsis. Why would she? This is about a phone call. Why would she alter the notes to fit her own synopsis? I mean, you just phone.
Well, I think the simple answer to that question is they had to come up with something. Because if you look at what actually happened in that case, Lucy alerted Dr. Harkness, and I mean, the prosecution are trying to prosecute on that infant when really she's the one that raised the alarm.
I don't know.
So they've got to come up with something. They can't just say, well, obviously we've been past this case. Clearly she's innocent. So they had to come up with something. I mean, to me, it's obvious that that's a gastrointestinal bleed, and the kind of allegations made by Evans are just absolute rubbish, aren't they?
Yeah.
So I assume that's the reason, but
So, I mean, that poor mother,
Hmm.
I'm sure that mother absolutely believes that her timings on her mobile phone are correct and that her memory is correct.
Yeah,
But that mother
I'm
was
sure.
in the middle of looking at her baby in the middle of a resuscitation, which is very traumatic. And we know that the mind plays tricks on you. I feel so much for that poor mother. And by the time she got to court and pulled the timings, she'd been absolutely brainwashed by the police and Dewi Evans and going to the trial that this was murder. And parents do look for reasons why their children collapse. They very often turn it on themselves. Is it something I did? I had that glass of sherry at Christmas. Should I not have had that glass of sherry? I went out without putting a raincoat on and I got wet. I mean, all sorts of bizarre things go through your head when your child dies. And this mother thought her child had died of natural causes. And then 2, 3 years later, gets a knock on the door from Cheshire Police saying, actually, we think it's a malicious act. I can't imagine the pain of those parents or any of the parents involved in this, not just baby E's mum. It's terrible. And they've had to sit through a trial. And now their lawyers, I don't understand why the new lawyers those parents have got, or any of the parents, have not gone to Mark MacDonald and asked to read the new expert witness reports. Because as a parent, even if I thought Lucy was guilty, I would want to know what people are saying about my baby.
Mm.
And I think their lawyers are also not helping to get to the truth of what's gone on. Because
Oh,
not,
absolutely.
I know
Undoubtedly.
Mark has offered their lawyers to send the reports, and they've said no, the parents don't want to do that. But I find that very strange indeed.
Well, I can't remember if I said this to you previously, but in my view, the parents are obviously their clients, so it's therefore incumbent upon them to explain to their clients, look, these experts have come along. These experts are very, very much more qualified than the experts that appeared in court. There are now 26 of these experts compared to 7 or 8 in court, and most of the experts in court didn't even do anything. They did next to nothing, most of them. So we have to, I'm just informing you of that, of your lawyer. We must take this seriously. You can't, we can't just hand wave this and say it's already been decided. And I know for a fact they haven't done that because I've read their statement and I've responded to it on this channel, and there's no indication that they have given, expressed to their client that these expert reports give a completely different impression of what happened to their infants. And surely it is their moral, ethical, and professional duty to do that.
Well, I would have thought so until I realised how flawed the law is, and it really is flawed. Um, I, they, you've got to understand as well that some of those lawyers worked for the prosecution, so they want to keep the guilty narrative going because they were part of the process that convicted her. But they're holding those parents to ransom as much as the police held those poor parents to ransom. And I've realised that court cases and lawyers and the police are not really about getting to the truth. They're about getting a conviction or proving what they're saying is true rather than justice and getting to the truth.
Hmm.
And the Court of Appeal definitely is of that ilk when they say, oh, well, we don't want to hear we will only hear new evidence because you can't have a second bite of the cherry. Well, that might be due process, but that's not justice.
Well, it's ridiculous, frankly. I mean, how can you allow someone to remain in prison when they have exonerating evidence and then just say, oh, well, you could have brought that up a few years ago? So, especially, I think something we really need to emphasize publicly with this is that yes, Lucy's situation is awful, obviously, but this has really serious consequences for the healthcare system. You can't just allow a hospital to say, "Oh, we'll blame it on this Not them saying they did that purposefully, but effectively that is what's happened. When really all of the stuff that actually happened on the unit should be being properly examined.
Well, I think you have to go back to my time when I was on the unit. So when things go wrong, it's never one thing. It's always multifactorial.
Mm.
And it's a slow drip, 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 drip. I know when I've been trolled by various people, they say, well, you're not relevant because you haven't worked there since 2007. But I do know what was going on in that unit, and I know the impact that getting rid of senior, highly qualified nurses has. And it doesn't happen straight away. It takes many years, and it's other things coming together to cause the perfect storm. Now, when I was there, the chief executive at the time was a man called Mr. Peter Herring. And he came to Chester in 2000, and he obviously had an agenda. And in 2012, he left Chester and became the chief executive somewhere else. And guess where that was? Shrewsbury. And we know what's happened in Shrewsbury, and there's a massive Donna Ockenden inquiry. And then in 2015, he left Shrewsbury, and guess where he went to? He went to Nottingham. Mm. Now, these chief executives, all the way along, have an impact into what happens. We've had Shrewsbury and Nottingham with two massive maternity inquiries where mothers and babies have died and been harmed. And yet in Chester, we had a serial killer nurse. And now Leeds is about to come on.
Mm.
Maternity units across the country are in absolute crisis.
Mm.
They're underfunded, they're understaffed. Midwives are expected to look after 2 or 3 labouring women, which actually is 6 people they're looking after because there's a baby inside, maybe even a multiple birth, who you can't even see. And they wonder why things are going wrong. They've got maternity support workers, they've got healthcare assistants. It doesn't matter what titles you give these people. The fact is, they are not registered midwives or nurses. It's like me saying to you, oh, I'm going to write a book. You've been writing numerous books. You're far more experienced than me. I wouldn't ever consider that I might just write a book for my own interest, but I wouldn't ever say, well, I'm a top bookseller or number one. And yet they think that nurses are interchangeable with people who are not qualified.
Mm.
I can't think of any profession where you would be deemed to be senior and yet not qualified in that particular speciality.
So, I mean, this is something that I've reflected on since I started doing this. I mean, I would like to think that when I began, I had a good appreciation of the knowledge that nurses have. But obviously, since I've interviewed a lot of nurses, that's become more clear to me. I've obviously, it's been an education for me, really, I suppose. So do you think, I mean, I feel personally that message needs to be more communicated more clearly. People need to understand what nurses do, what nurses understand, and how
Absolutely.
important they are.
I think the same way that there's always been this ethos that doctors are gods, there is a public image that a nurse is still in the Florence Nightingale mode and mopping the fevered brow. But nurses are now highly qualified. They undertake numerous further educational programs in a specific speciality. They're using very complex equipment, drugs. It's a different world, and certainly when you get into neonatology, it's a very different world with the, the care and everything. It's very different to, I think, how the public perceive nurses
Yeah.
in general. But I think the public also, I mean, when you look at the maternity scandals that have gone on, they haven't been driven into the public arena by hospital chief executives going, I need to whistleblow on the government of how much they're cost cutting or how I'm being put in this position or given a directive from the Department of Health to get rid of half my registered nurses. It's been driven by parents who've tragically lost babies. And that's why the government have launched inquiries. And Wes Streeting, I think a month ago, said he's going to look at 10 maternity hospitals now. And he needs to, because from my understanding, a lot of them are in crisis. But Chester was no different than those. I think the difference was the consultants pointed the finger at a nurse.
Yeah, well, they did have sewage and all that. I mean, that seems like that would be unusual.
Well, I wish I could say it is, but it's really not. A lot
Okay.
of a lot of hospitals in England are very old.
Mm.
They're not fit for purpose. They haven't been replaced for a long time. There's lots of issues in all sorts of departments, and yeah, it's
Not as uncommon as I might think.
not as uncommon. I'm not saying that it's right because it's
Yeah.
not. It's dangerous, but I don't think it's as uncommon as you think it is.
Okay. So I'm going to ask you some specific questions now about the court case and some of the infants. We're going to talk a lot about childcare and the extubations, but I
Yeah.
want to ask you firstly about this assertion of overfeeding with milk. Now, everyone that I spoke to about this is treated with complete derision. So you think it's ridiculous. So can you elaborate on why?
I just think it's nonsense. So overfeeding with milk, if you're tube feeding, um, you use a 10 ml syringe. You never use anything more. So if Lucy had been pouring 50 mils down, a 50 ml syringe is quite large. People walking past would go, "What are you doing?" So she was using the correct equipment, which is 10 mils. So to overfeed a baby, you'd have to, and you usually allow gravity for the milk to go down, but to overfeed it, you'd probably have to plunge the plunger. So, and babies just puke. It's simple as that. Plus, if you, I would think, overfeed a baby, not only would they puke, but they'd run the risk potentially of possibly having an aspiration. So the milk would go into their lungs, and then they'd be in really big trouble and they'd get an aspiration pneumonia. None of these babies had an aspiration pneumonia. Dewi Evans says that some of the babies, definitely were overfed because when they were aspirated back, they had greater stomach contents than the amount of milk that was documented to have been put down. Well, they would do because you've got gastric juices. So if you put 5 mils of milk down and then 3 hours later you get 15 mils, it's a bit like having a blocked sink. Those gastric juices are still going into the stomach and increasing that volume. But for whatever reason, that milk wasn't being absorbed, maybe because they were brewing a gastric issue such as necrotizing enterocolitis. So it's like having a blocked sink. So you would get more back. And that's why the babies then puke. It's not rocket science, really. I don't believe, and you know, and to overfeed a baby, she'd had to draw the milk up, plunge it down. When you let go of the tube, when you take the syringe off the tube to draw more up, to overfeed, the milk would come back up the tube as well. It's just nonsense. And nobody saw her do any of this. It's the same with the air scenario. You know, Dewi Evans talks about, well, she injected air down the nasogastric tube. And that caused, well, first of all, he said it caused murder, and then he said it destabilized them. I've injected air down the nasogastric tube, as we discussed last time in the whoosh test. But to inject 100 mils, you'd have to draw up the 10 mil syringe, disconnect it, draw up air, push it back. I mean, it's just, and nobody saw her do anything. It's just nonsense. It's ludicrous.
Well, I mean, I found this video of the neonatal unit. So when you hear them talking in court, you think of this like vast building where people, you know, and then you see how close it is together, and
yeah,
there's just no way. There is no way you could. It's like now, what is it, 24 attacks with no one seeing anything or suspecting anything, and all the rooms are right next to each other. There's a corridor there. There's people coming out. There's just no way. It's just absolutely ridiculous.
It's just ridiculous. And when you talk about Baby O, Dowie said that that was an inflicted liver injury. He didn't say how she inflicted the liver injury, but you know, this baby's in an incubator. So between the baby and the incubator, there's maybe 12 inches. How would you? It's just not logistically possible. And what would she use? I mean, did you know, if you had an impact injury, why didn't that baby have bruising? Because if I came and hit you or punched you, you'd have a bruise. But this baby didn't have any bruises. It's the whole thing is how you sell a story. And Dewi Evans and Nick Johnson sold a very good story that is based on sounding good, but it's not based in fact. And their theories and hypotheses which do not stand up to scrutiny.
Yeah. So, speaking of not standing up to scrutiny, we're going to talk about child K and the extubations at some length now. So, the first thing I want to ask you about is that in court there was a lot made of Lucy standing over a baby, as it was described, whereas every indication I've been given is that this is just a normal practice of observation. So, could you elaborate on that a bit?
So when an alarm goes off, those alarms are very intrusive. They're very loud, they're very shrill. And these are very vulnerable, delicate babies, including their hearing. So the first thing you do is you look at the screen, you hit what would be like a snooze button to silence it. And if you don't correct the problem within a given length of time, usually 60 seconds, the alarm will resound. So when they say that the alarm was switched off, that is not true. The alarm was silenced. And then, as a neonatal nurse, you stand there and you look through the perspex of the incubator and look at the baby. Because that alarm might be alarming for something as simple as the baby's wriggling and the probe's lost contact. Doesn't mean it's always because there's something going on. This baby, baby K, weighed 800 grams, I think. And these babies are very small. They're very vulnerable. Every time you open those incubator doors, you increase the risk of introducing infection to that baby. You increase the risk of actually dislodging a tube or a cannula or a line. So you never put your hands in that incubator until you've assessed what you think the problem is. So if Ravi had walked into nursery 1 and I'd have been there, I would have been stood there doing exactly the same thing, looking at this baby through the incubator before I ever put my hands in. And Ravi would know that. So I don't know why he's saying this about Lucy. He knows what neonatal nurses do. I think he just embellished his story to make it sound good, that she wasn't doing anything. And also, he's admitted her hands were not in the incubator. So how did she dislodge the ET tube? I mean, that's quite miraculous. Her hands were not on this baby. They were not in the incubator. Yet he's saying she deliberately dislodged the endotracheal tube. He also, on the ITN documentary, said the 25-weeker can't dislodge their ET tube. And that is absolute rubbish because babies wriggle, 25-week gestation babies wriggle. The tubes themselves are tied in via their bonnets. They're not what's called cuffed. So they can slip in and out of the trachea. These babies are very small. So I think baby K's tube was said to be 7.5 centimeters, which is maybe that long. So that baby only has to slightly move his head and move it a centimeter and it's dislodged. Yeah. So I think Ravi just told a very good story that is definitely not based in fact. And as I say, if he'd have walked in on me, I would have been stood at the incubator appearing to not do anything. But it wasn't that I wasn't doing anything. I would have been assessing that baby. And I think that's exactly what Lucy did. And on the stand, she said that she was taught to do that in Liverpool Women's Hospital. But then you've got Elizabeth Morgan, who gave a statement to the court. Now, Elizabeth Morgan's an interesting character. She seems to have disappeared, but we've looked at as much information as we can from her. She's not pediatrically trained and she's not a midwife. She's an adult nurse. She has undertaken apparently some neonatal training, but a long, long time ago. And she now works in management. And she's registered under South Wales. So is she a friend of Dewi? In her statement that was read out to the court, she contradicts herself because part of the statement she actually says, yes, you assess the baby before you do anything. But then later on in the statement, she says, oh, you definitely wouldn't wait to see if a baby self-corrects a 25-week gestation baby. So which is it? That you stand there and you assess the baby or you immediately intervene? Her statement contradicts it. But I don't think she's neonatally trained. I don't think she works clinically. From my understanding, she works in management. So again, she should not have been an expert witness talking about things when she doesn't work clinically and she doesn't work in a neonatal unit.
And how, I mean, I don't think we know the answer to this question, but how is it that someone who's not at the hospital, who's not a neonatal nurse, who's really nothing to do with the case, who doesn't appear in court, how is it that she's allowed to make a statement and
Because
then
the prosecution employed her. And I think they probably employed her off the back of Dewi Evans. She's certainly registered in South Wales. I don't know that. That's a hypothesis. So I don't know whether that's true or not. But she's definitely registered under South Wales. So it's not a million miles off that Dewi said to her, we need a nurse to write a statement. It was, after all, Dewi that advised the police on who to get to peer review. Initially, Dewi Evans had Martin Ward-Platt, who's a consultant paediatrician who was involved in some very famous miscarriages of justice, Sally Clark being the main one. And he's very, very much in the camp of Professor Roy Meadows, who's been very discredited. And he was involved in Sally Clark, Angela Canning's, Trupta Patel's cases. So Martin Ward-Platt was going to peer review Dewi. Tragically, he passed away before the trial. So that's when Sandy Bowen was engaged. And again, she doesn't work clinically. She says that she does 4 weeks in Bristol every year because she lives in Guernsey. Now, Guernsey has a 2-cot special care baby unit. 2 cots, that's it. And it's a special care. All the babies born in Guernsey who are sick are transferred to the mainland. To maintain her skills, it says on her CV that she attends Bristol for 4 weeks a year. I'd really like to know when was the last time she went to Bristol, because I think that's a tick box exercise. I don't know that, but I'd like Bristol to say, could you tell me, when did she last update her skills? But anyway, she's working in a 2-cotted special care baby unit. And then all the other experts that came along, there are serious questions about their evidence. And they were all paid. These are all hired guns in my head. They're not eminent, they're not respectable, and they've all got issues. So Prof. Hindmarsh, we now know, had some of the strictest restrictions on his license to practice by the GMC. I don't know whether he declared those to the court, but if you've done something wrong, and I don't know what he'd done wrong to get those restrictions, but he definitely did have restrictions on his license to practice, which indicates he must have done something wrong for the GMC to do that. How can he be allowed to be an expert witness in a court case when he's potentially discredited? Again, that's another part of the justice system which I don't understand, and the justice system is not what I thought it was at all.
Yeah, I mean, I obviously I'm used to him by now, but when I'm staggered by Dr. Evans, if you just said to me how I would expect an expert witness to be and how I'd expect them to behave and what I'd expect them to be like intellectually, he's nothing like what I would imagine. When I started doing this, I really expected at some point he would come along with something like really surgical and complex and put a spanner in the works. And every time he speaks, it's just like total nonsense. I mean, I said recently, I think in one of the comments, someone commented to me, I don't even really understand how he qualified to be a paediatrician, because obviously he must have been competent to some degree because he was in Swansea for a long time, but whenever he speaks, he just talks absolute nonsense. Like when he turned into Panorama, it was like he'd done no preparation at all. And it boggles my mind.
And he changed his mind on the stand, and he's changed his mind subsequently. He apparently has written a new report, which Mark MacDonald hasn't been able to obtain. But how can you be an expert and get somebody convicted, and then a year after the trial go, oh, I've changed my mind, but it doesn't matter because I think she did it anyway. But how I said that she did it actually isn't how she did it. I've now changed my mind. How on earth can the British justice system allow that nonsense to be put out? I mean, the world must be just laughing at our justice system. They must be absolutely just howling.
Well, I think it is a national embarrassment, and I think the embarrassment's only going to become bigger the longer that it drags on. I mean, this has to be addressed as soon as possible. Um, and I'm sure people, I think it will be something that other countries will look at and think, how has this been allowed to happen? So, I mean, hopefully some good can come out of what is a very dark situation eventually. But, it, I mean, I just find the whole thing extraordinary in terms of what happened in court. The number of statements that are made that are either just complete fabrication or on a couple of occasions, I've caught the prosecution saying things that are demonstrably untrue.
Yeah, yeah,
How can that be allowed to happen for such a serious case? And the thing that's concerning for me, as I said previously, no one seems that bothered. Like no one's
yeah,
like Ben Myers isn't jumping up and down going objection, objection. At least go, oh well, never mind, we'll just carry on. So that makes me think it happens all the time.
yeah.
But
I think it does. I learned a very interesting statistic recently that in the past, miscarriages of justice were reviewed by the Home Secretary. And I think it was after the Birmingham Six, they decided that it shouldn't be the Home Secretary, they should set up this committee, which we now know is the Criminal Cases Review Commission, which Mark MacDonald has submitted lots of documents to on behalf of Lucy. But the Criminal Cases Review Commission, which has its own set of problems, and the head has just left and the deputies left, takes an incredibly long time. But apparently, the statistic is that they refer less cases for miscarriages of justice than when it was the Home Secretary reviewing them. Now, my question with that is then, is that because the Home Secretary is a politician, not necessarily a lawyer, is reading these cases with potentially a more open mind and looking at things and thinking, actually, this doesn't sound right? Whereas the Criminal Cases Review Commission is being looked at by lawyers who, again, are more interested in following the law than looking at what is justice.
yeah, and I think the simple answer to that question, Michelle, is yes.
Yeah.
That is the reason. Because you and I and people that are not legally employed, we look at a situation and think, what is the most likely outcome and what is the most just outcome? And I just don't. I mean, when I see us, I mean, I respect some lawyers. I mean, I've spoken to lawyers, and it's not that I disrespect all of them, not at all. But I do at times find them to be speaking like a foreign language that just bears no relation to anything that happened in reality. It's just very strange. And I'm sure you're absolutely right in your assertion. That is basically why there's been less cases referred, because they have a loyalty to the law and the legal system that an MP wouldn't have. I'm sure that's the reason.
Yeah, and also, they probably all want to climb the legal ladder. They maybe have aspirations of being cases or judges or whatever. There's definitely financial incentives. The CPS has unlimited budgets, from what I understand, whereas defence is reliant on legal aid, and legal aid is being cut and cut and cut. We don't. The experts that are hired are either for the prosecution or the defence, and I think that's totally wrong. I think the experts should be totally neutral, and we need a system where it's the criminal justice review, not the criminal prosecution or the National Crime Agency, which all imply guilt. But yeah, and also, like any profession, again, it's a bit like consultants. One consultant is very loath to call another consultant. They might not publicly agree with what they're saying, but they won't publicly call them out. And I've had experience of that. My father, I took for a second opinion, and the consultant that we'd seen, that I said I want a second opinion, absolutely had a complete hissy fit on me and said it's not good form to ask for a second opinion. By this point, I was like, well, I don't really care what you think, but and when we went to see the second consultant, he never said a word about the first consultant. He just very quietly said, yes, I think your father does need chemotherapy and he does need surgery, which was completely different to the first consultant we'd said, who said, you just have to accept he's going to die and there's no treatment. And I know
It's a pretty big deal, isn't it? It's not like,
I mean, he lived another 10 years after that,
yeah,
and had a good quality of life. But I've learned through talking to so many people in this case that in the States, it's very different with doctors, because they are so terrified of being sued that they all want to sing from the same hymn sheet. So they actively encourage you to get a second opinion. Whereas in England, consultants take it as a personal affront of, how dare you question me? Are you saying that what I'm saying to you isn't true? And that has to change, because they should be open and transparent. And medicine is not an exact science. There is discrepancies within medicine, and there's the postcode lottery as well of, different areas offer different treatments.
Yeah, absolutely. Let's just finish off childcare quickly, because I want to ask you about the tube extubations in Liverpool as well. So, in the case of childcare, we all suspect now, people that have studied the case, that Caroline Oakley was actually present, not Lucy. So I believe that you know Caroline.
Yeah, I worked with Caroline for many years. She's not dissimilar looking.
Okay.
She's got blonde hair. She's probably about the same height. She was in nursery one and had two babies. There's a lot of discrepancies about baby K that I can't get my head around. So it was said that Caroline Oakley had left the unit. I don't know, maybe she went to use the ladies' room. At the same time, Joanne Williams left the unit to go and talk to the parents and supposedly asked Lucy to babysit nursery one. But that then meant that nursery two, which is high dependency, had no nurses in it. And you would never leave either of those two nurseries unattended. So does that mean one of the nursery nurses went to babysit in high dependency, which is a huge red flag? Is that why Lucy went to nursery one? Or we know the CPS got some of the swipe data the wrong way round. Was Caroline Oakley still in nursery one? Did Ravi get confused? Ravi had been sitting at the nurse's station and he said he had a gut feeling. And the other nurse had told him, Joanne Williams, that Lucy was going to babysit. But he would have known Lucy was going to babysit because Lucy would have had to walk past him from nursery two to get into nursery one. She would have had to walk past Ravi sitting at the nurse's station. So I think there's a lot of unanswered questions with baby K. But either way, we know that Ravi in court and to the police said that he'd walked in and caught her virtually red-handed and that she hadn't called for help. In an email in 2017, which is still nearly a year after the event, he said that she had called, so that's another lie. And saying that Lucy was stood there not doing anything, well, as I've said before, if he'd have walked in on me, I would have appeared to have not been doing anything. But you're standing there assessing that baby. So I don't know. I think Ravi by the time of the baby K trial was absolutely on the crest of a wave. He'd been talked about in Parliament by Rishi Sunak. He'd been called a hero. I'd love to know why, out of all the babies that the jury in the first trial couldn't reach a verdict on, why was it baby K that the CPS decided to retrial? And I hope that Ravi wasn't badgering them, saying, you know, I caught her virtually red-handed and that's why they retried it. Because I think under those circumstances, his mind definitely could have played big tricks on him.
Yeah, and we should say as well, just mention briefly, this did happen at three to 4 o'clock in the morning.
Yeah,
So,
baby was born at 12 minutes past 2. The only reason he was in the unit was because the registrar had only been a registrar for 3 weeks and phoned him up and said I'd never dealt with a 25-week gestation baby. That's why he was in there. And in fairness to Ravi, he'd worked all day. He'd gone home probably at 5 o'clock at night. He was on call. He'd been called out at 2 in the morning, and it was 3, 4 in the morning. So yeah, maybe he was tired. Maybe, who knows?
yeah, absolutely. So let's talk about the tube extubations in Liverpool. Now, I think we all consider these to be ludicrous allegations, but what's your opinion on them?
Absolutely ludicrous. So they first were mentioned back in, I think it was December last year, when the police said they were looking at potentially more charges. And at that time, it was said that there had been an increase in extubations at Liverpool Women's Hospital in babies that Lucy was caring for. And there was also one baby that had water in its breathing tube. So let's just deal with the water. Every single baby that is on a ventilator, the gases they give, the oxygen, is humidified. So you basically get what we used to call rain in the tubes. It is condensation. And every so many hours, you disconnect the tube, you pour out the water, and you reconnect it. And that happens across every single baby in intensive care who's on a ventilator. So the police saying there was water in a baby's breathing tube as if it was really bad and dangerous is just nonsense. Then we get on to the extubations. I'm not a statistician or a mathematician at all, but the talk was there was a 40% increase, and it was Bill Yoxall who's done these investigation. And Bill Yoxall is big mates with Steve Breary, and actually going back to Lucy, he was reading Steve's documents to make sure that there was no legal implications for Steve Breary, apparently. Yeah, I mean, one of the emails says, oh, I've checked with my union, but can you just recheck it?
Yeah.
And then Bill Yoxall went on to be paid by the police to look at these cases. So subsequent to the Panorama programme last week, where the BBC have had to issue an apology and change the script, it was reported again that there was a 40% increase. From my understanding, it was not 40%, it was 4%, which is completely within the normal range. Mm. Secondly, Lucy, when she was at Liverpool Women's Hospital, was undertaking further training, her QIS training. So she would have been supervised. So there's other people around. Secondly, that is a very big unit. Hello? Sorry. I've lost you.
Hello, can you hear me?
Yeah, I can't see you though. I don't know what happened then.
Oh, don't worry, I'm still here. I'm still here.
Oh, okay. Sorry,
Yeah.
my phone rang.
Don't worry, it's fine. So
yeah.
you're just saying that the unit in Liverpool was a big unit?
It's a 40-odd cottage unit. It's a very big unit. I think they've got 12 intensive care cots, 12 high dependency cots, 20 special care cots, and 8 transitional care cots. So, you know, it's nearly 50 cots. It's a big unit. And in a level 3 unit, you don't just have the nurses, the advanced neonatal nurse practitioners, of which I believe there's about 18 advanced neonatal nurse practitioners in Liverpool women, so there's lots. But you also have research scientists, you have physiotherapists, you have all sorts of different doctors there. You have parents, you've got 40 odd sets of parents coming and going, plus. And again, Lucy is supposed to have done this and nobody's seen anything. It's just ridiculous.
Yeah.
It's ridiculous. To me, it's the police grasping at straws. And certainly the statistics, again, all the statisticians are absolutely calling this out.
Yeah.
Saying this is nonsense. I think the actual figure was that out of 11 shifts, there was 4 extubations. No, less than that.
It's a really no, it's 4. It's a really that's the other thing as well. It's such a small data set. I mean, it just doesn't mean anything.
Yeah.
You might as well say, oh, she was on shift once, so 1 tube came out, so it's 100% of the time.
Yeah.
Obviously, that's total rubbish. So it's just crap. I mean, hopefully, it's just going to die a death, and the CPS aren't going to be stupid enough to move this on. But
I don't think the CPS will recharge Lucy. There's too much swirling around now. I do hope the CCRC kick it back to the Court of Appeal. I have big concerns about the Court of Appeal, though, because they're a very different animal. And I hope that instead of following the law as such, they look at what's actually gone wrong in this trial to prevent it happening to anybody else or any other complex cases. Because the law hasn't moved on with the technology or anything, and maybe this case will make it pull its socks up.
I mean, it has to open the floodgates, because I mean, I did a little bit of research about the history of the system, and it's barely been reformed for not even decades, centuries. And look at how much the world has changed in that time. And of course, it's not only that. There's now centuries of experience for prosecutors of knowing every trick in the book of how to manipulate people. So, you need to get good evidence into court. It's essential. I mean, the jury's got no chance in this case.
No.
They're completely reliant on the experts. If you just have an expert who's willing to stand there saying, oh, it's this. Oh, no, wait a minute. I've heard a few statements in court. Now I'm just going to change my mind. What chance has the jury got? It's just absolutely ridiculous.
Judge Goss allowed so many things which I really don't think he should have allowed.
No.
The parents gave emotional testimony. Now, we don't know who the jury are, but have the jury tragically lost children, grandchildren, had stillbirths? Listening to those parents, it was harrowing, absolutely harrowing, some of their stories, but it wasn't evidence. No. It was emotional testimony. He allowed... he said, let the jury make up their mind about whether Dowie's a reliable witness. Well, Judge Jackson had written to him. How can a jury decide who's a reliable witness? They're lay people.
Yeah, I mean, it's ridiculous to say that. I mean, he should have been gone.
Yeah.
I mean, I can't remember if I said this last time, but I just think he just realised the court would look too ridiculous, the criminal justice system would look too ridiculous, the police would look too ridiculous, a lot of money had been spent. So he couldn't throw him out. I think objectively he should have thrown him out.
Well, I think he should have thrown him out. But what's looking more ridiculous now? This trial.
Absolutely.
And they're spending even more money. Thirlwall's cost, I don't know, 20 million.
About that.
It's going to have to go through the Court of Appeal. It's just all totally wrong.
Yeah. So we'll leave it on that note. I think it sounds like a perfect way to end the interview. So
I'm sorry about my dog interrupting.
It's all right. We did pretty well. We did pretty well. We did quite well. I thought my dog was going to start barking. There's a yappy dog down the road who started yapping, and like Kiko was going, rrr, rrr, but she didn't. She was calm, so it's fine. So yeah. Thanks so much for joining us again. I know people will really enjoy this. We got so many great comments last time, which were all merited because of your knowledge and expertise. So really grateful. And just for viewers, we'll get Michele on again, but we've got to let her go to Spain first. Yeah. So we'll get her back soon, though. And thanks again, Michele. I really appreciate it.
Thank you, Chris, for the opportunity.
No worries.
Okay, take care.
Yeah, you too. Take care.